Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Tubal sterilization. Introduction. Tubal ligation is a common form of permanent contraception for women. Tubal ligation is very safe and effective. This patient education program explains what tubal ligation is and discusses its benefits and risks. Anatomy. The female reproductive organs include the vagina, the uterus, the fallopian tubes, and the ovaries. The female reproductive organs are located in the pelvis between the urinary bladder and the rectum. The ovaries have two main functions. 1. The production of specialized hormones such as estrogen and progesterone. 2. Ovulation or the release of eggs needed for reproduction. When an egg is released, it goes down to the uterus through the fallopian tube where it may be fertilized. If the egg is not fertilized, the egg and the inner lining of the uterus are discharged to the outside of the body during the menstrual period. As menopause approaches, periods become irregular and eventually stop. Menopause occurs when the ovaries quit producing hormones and releasing eggs. Indication. The goal of tubal ligation, also called tubal sterilization, is to divide both fallopian tubes in order to prevent eggs from ever meeting sperm. Depending on the woman's health, the doctor may recommend tubal ligation if she is certain that she never wants to become pregnant. Tubal ligation is considered a permanent form of birth control. The operation can sometimes be reversed if a woman later chooses to become pregnant. However, reversal surgery is expensive and not always successful.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Procedure. Tubal ligation is usually done in a hospital, but can also be done in an outpatient surgery clinic. The surgeon can reach the fallopian tubes in one of three ways. 1. One way is called laparoscopic tubal ligation. The surgeon uses small incisions and a scope to see inside the abdomen. 2. Another way to reach the fallopian tubes is called laparotomy. In this procedure, a bigger incision is used than in laparoscopic ligation. Laparotomy is usually used when a woman is already having a cesarean section to deliver her baby. 3. A third way the surgeon can reach the fallopian tubes is called a mini laparotomy. For this procedure, an incision is made that is smaller than a laparotomy incision, but not as small as laparoscopic ligation incisions. All three approaches are typically done under general anesthesia. Epidural anesthesia may be used if the ligation is done at the same time as a cesarean section. With general anesthesia, the patient is put to sleep for the procedure. With epidural anesthesia, injecting special medication near the nerves in the back numbs the abdomen and legs. There are several ways the fallopian tubes may be divided or cut. The tubes can be tied with special suture an inch apart. The part of the tube between the two sutures is then cut off and taken out. The tubes may be electrically burnt or coagulated and then cut at the level of the burn. The surgeon may use silicone bands or clips to divide the fallopian tubes. Your doctor will talk to you about the best method in your specific case. Risks and complications. A tubal ligation procedure is very safe. There are, however, several possible risks and complications. These are very unlikely, but possible. Risks are related to anesthesia, surgery in general, or tubal ligation. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. Risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attacks, strokes, and pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is extremely important to let your doctors know if any of these symptoms occur. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs. Some risks are seen in any type of surgery. These include 1. Infection, deep or at the skin level. 2. Bleeding, either during or after the operation, which may require a blood transfusion. 3. A skin scar. Other risks and complications are related specifically to tubal ligation. The surgery may not be successful in closing the fallopian tubes. In such case, pregnancy would still be possible. The chance of pregnancy after tubal ligation is less than 1%. In the very rare case that pregnancy occurs after tubal ligation, it is more likely to be an ectopic pregnancy. In ectopic pregnancy, the fertilized egg develops in the fallopian tube and not in the uterus. Ectopic pregnancies are life-threatening if not treated. Rarely, structures in the pelvis and abdomen can be injured during the surgery. This could happen especially if there is significant scarring from previous surgeries, endometriosis, or pelvic inflammatory disease. If this happens, another operation may be necessary. In extremely rare situations, small nerves in the pelvis may be injured, resulting in decreased sensation in the sexual organs. Rarely, this can lead to sexual dysfunction. In laparotomies or mini-laparotomies, hernias may occur but are rare. Since this procedure does not remove the ovaries or the uterus, patients still have regular menstrual periods and produce estrogen and progesterone until they reach menopause. After surgery, strenuous exercises should be avoided for several days after tubal ligation. To control incision pain, pain medication is usually prescribed. Women are usually able to return to work within a few days of the procedure. Women who have tubal ligation can start having sexual intercourse again when they feel ready.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Tubal ligation, also called tubal sterilization, is a very common contraception method for women. Tubal ligation is very successful in preventing pregnancies. While it is considered very safe, like any surgery, tubal ligation entails certain risks. By learning about these risks and their symptoms, you may be able to detect them early if they happen. Tubal ligation should be considered permanent and non-reversible, and should be chosen after careful consultation with a doctor.
Thank you for using Explain.